Welcome back to Path to Med. Today we're joined by Dr. Pagnotta, a Western University alumni who earned both a Bachelor of Medical Science and a Doctor of Dental Surgery, each with distinction. And he's now the co owner of a family dental practice. So it's so nice to have you on the podcast.
Oh, thank you for having me.
So, kind of just starting off, what drew you to the medical field initially and then to a career in dentistry?
Yeah, so it was really an interest, and I enjoyed sciences. Math and sciences were sort of my favorite subjects coming up through high school, and the dentistry specifically interested me because I do like to work with my hands and very hands-on kind of person, and there's a little bit of history in my parents are both hairdressers, so they obviously work with their hands. So I think maybe it's in my maybe in my blood
Your
somewhere along
DNA
the
a bit, yeah.
line. So we are destined to be working with our hands, just a different part of the body, I guess.
Yeah.
So
Awesome. I guess you kind of just experimented and then found out what you liked, and then it led you to dentistry.
yeah, I've growing up, I also had part of it. I had good experiences at the dentist. My dentist, my family dentist in Sault Ste. Marie, when we were growing up, he was I actually I played sports with his son, and so I knew them, and they were. It was always a good experience. I always thought of it as a nice experience going there, talking with him. So then I kind of started thinking about it. I'm like, oh, this seems like a pretty good career. So it also led me down that path. So
Yeah. Yeah,
yeah.
that's awesome. Just in general, what are the rewards but also the challenges of a career in dentistry?
Well, I think with any job, there's challenges, there's good and bad, but I think to your first question, the rewards, I feel like for the most part, I think people are appreciative of what you're doing. You're trying to help them, and oftentimes it's maybe one of the few professions in the medical field where someone can come in with a problem, and sometimes within that appointment, that 1 hour that you're with them or a couple of hours, you can solve that problem. They come in with a toothache, you could essentially fix that tooth or do whatever you need to do and get them out of pain. And it's satisfying because you get to see you know something to its completion, and people obviously appreciate that if you can help them when they're in a difficult situation. um,
Mhm.
so that's the rewarding part. The challenging part is also, you're in the public eye and dealing with different people and different personalities. You have to you're seeing all people from all different walks of life, and you're having to deal with different personalities. Sometimes you have to be part uh psychologist and part dentist. You're having to deal with not just they're not just a mouth with teeth. There's a person attached to that you have to also, you're helping them and listening to them, and sometimes that's part of what they need is just someone to listen and be present for them, not just jump right in and start doing the work.
Yeah.
So
I
that's
mean, it sounds like the people are kind of a reward and a challenge in your
yeah.
job, because it's probably so fulfilling to see them get treated from start to completion, be able to see them get better. But then also, I think any job that involves people can obviously have its challenges as well.
Yes, yeah, exactly. Like it's, I guess, yeah, like any job that you're dealing with people day in and day out, like multiple people in a day, you there could be sometimes you just run into people who are just, grumpy or, unhappy about something, maybe not necessarily anything you're doing, but you have to deal with those people, and so it can be difficult sometimes. Not everyone comes in and they're super pleasant. So you have to be
I'm
able to
happy to be at the dentist.
you have to,
Yeah,
I know,
definitely.
and I gotta say, for the most part, people are actually pretty good. Like I still get the people that say, "Oh, no offense to you, but I hate being here," but they're generally speaking, most people are appreciative, and that outweighs the bad. So you know, I guess if you deal with enough people in a day, there's always going to be someone who's maybe not the most pleasant, but for the most part, I'd say most people are, and it's usually, like I said, outweighs the any of the negativity that you might encounter. So
Yeah. Yeah, that's awesome.
yeah.
So, next, could you walk us through the educational journey to becoming a dentist in North America? Just the general pathway.
Um, well, in high school, of course, I don't know if there was a prerequisite in high school that you had to take certain courses. I don't remember that being the case, but I took all the maths and sciences and everything
Yeah.
that I thought would prepare me for the next step. Um, and then in university, I chose university. In this case, I chose Western because it had a dental program. So I applied to a couple of universities that had the program in-house, which is not always the case. I know a lot of my classmates, they took undergraduates in various, parts of Ontario or other parts of Canada, and then they came, they applied afterwards. But I thought it just made sense for me. I I did my
Yeah.
undergraduate there. I believe now at the time it was only there was some prerequisite courses you had to take. I believe there was like an organic chemistry and a physiology and a couple other science specific courses. But aside from that, there wasn't any other, you didn't have to take like a pre-dental, undergraduate. Um, and at the time as well, it was only, I think the minimum requirement was like 2 years of undergraduate. However, it was very difficult after 2 years, like unlikely that you would, unless you had absolutely stellar marks that you'd get in after 2 years. So it's
Yeah.
usually 3 or 4, but I believe now it is a minimum requirement of an undergraduate degree. So you
Yeah.
essentially have to do at least a 4-year degree before even applying, which is what I ended up doing anyways, which in the end is not a bad thing. It gives you some perspective. You learn about other things, before you get into dentistry, and then it gives you sort of a better overall, I don't know, life experience, I guess. Coming
Yeah.
out of
Yeah.
work. So
And so, can you, as long as you meet like the dental school prerequisites, can you do any undergrad or um,
yeah,
is it like encouraged to do a more like
no,
pre-dental, pre-medical undergrad?
um, I don't think there's a no. I don't believe they don't really require that you take. I know a lot of people thought or maybe still think that you need to probably take something in the sciences, but I had classmates of mine who, had degrees in psychology, other unrelated, disciplines, business. I had one classmate was in mathematics, so um, yeah, there was nothing you didn't really, as long as you covered those few courses that were required at the time, then you were
Yeah.
able to take whatever undergraduate you wanted. So
Oh, awesome.
yeah.
Okay. After the 4 years of undergrad, then you would enter dental school, right?
Yes, yeah, there you apply, you have to write a dental um, entrance exam called the DAT. Um,
Okay.
I think it's like the MCAT essentially, but for
For
dentistry.
dentists, yes.
And
Okay.
the LSAT, all those acronyms now, they're all coming back to me. But yeah, so the DAT, you have to write that, and then and if you do that in combination with your marks, if they're competitive, then you get next step is the interview process, and they interview you, and then you find out whether you're accepted or you're on a wait list or whatever the case may be. So I'm sure they still probably do it that way. That's how it was when I went, but I think it's
Yeah.
still done that way.
Yeah. And so after you graduate like dental school, how common is it to do a specialty? Like orthodontics or oral surgery or something like that?
Um, I guess it
Or do you
really
find that most people kind of stay general dentists?
I just going from my own small sample size of my class, I would say you could imagine probably about 15 to 20% of people continue on to do a specialty. Um, Not everyone does, but yeah, there's a small percentage. Yeah, I'd probably say about 20% of people did that. Um, there were the few that came into our class on day one and they said, I'm going to be, you know, my dad's an oral surgeon or my mom's a periodontist and I'm going to, as soon as I'm done here, I'm going to go straight into that. But for the most part, I think the 4 years gives you a little taste of, you do every discipline in dentistry because there's different branches, and you might come into it expecting like, oh, I'm going to be an orthodontist, but then you realize that maybe you don't like orthodontics after you've actually done it, and so it's a good feeling out process. I think a good thing which I didn't do, but if I could go back in time, I probably would have done. You can do a general residency after you're finished for like a year or two, depending on which school accepts you, and it basically it's like you've graduated, but you continue on as a resident and you are immersed in all the different aspects, and then you can really further hone your skills. And then if you really want to go into a specialty after that, it's a good path. But you've been out in the working world.
And it's good that the general residency and also just dental school kind of expose you to um, all those different fields in dentistry, so you can kind of get a taste of each of them.
Yes, yes. I think the general residency is a great thing because you really get more exposure in dental school. Their last couple of years, you start to see more in clinic patient experience, but there's still a lot of theoretical classroom knowledge that has to be taught. And so when you get out, once you graduate and you do the general residency, now you're fully immersed. Every day you're doing things with patients, so you really get that experience that you don't necessarily get after your 4 years of dental school. Even though you've done some things, you're not really, you're not fully immersed in it until you start on day one of your career. So,
Yeah. And so, what does the training to specialize involve, and how long does it take?
so it depends on the discipline that you decide, but they're generally speaking 2 or 3 years in addition to your dental school training. So after you're done, let's say your dental school, there is still an application process. If your marks are competitive or you've done a general residency and you can add that as experience. You can go back and apply. Different schools offer different disciplines. So not every school offers, orthodontics or periodontics. You have to kind of search those out, but they're generally like 2 or 3 years, a 2 or 3 year program um, to become a specialist. So
When you're doing your specialist training, is it similar to dental school, or are you working in clinics? Like, what does it
um,
involve, I guess?
well, I haven't actually, well, I haven't, I'm still a general dentist, so I haven't gone through that process, but from friends of mine and colleagues, it is it is sort of a continuation of dental school in the sense that there is some in classroom teaching. However, there's more of an emphasis on, in clinic patient interaction, getting your reps in, as they say, seeing people. And yeah, there's definitely heavier emphasis on the clinical aspect. So you're sort of doing it in tandem. I would say in dental school, you're still doing a lot of classroom time. So you're probably in the last couple of years, you're doing, 70% classroom and 30% clinic. Whereas when you do a specialty, it probably is skewed more towards clinic, like the majority of your time is spent in clinic, maybe 60-40% or something like that. So because they already assume you have some knowledge, you have a base of knowledge in that discipline, and now they're just kind of adding to it. So
Yeah.
yeah.
And if someone is thinking of specializing, I guess you probably thought of this as well.
Yeah.
What factors do you think they should consider?
Yes, I did consider it. I think they should probably ask themselves, is this something I want to do day in and day out? There within the discipline there is some variety, but you're specializing in one specific branch of dentistry, and if you're okay with that, if you're okay with doing, you know, let's just use an example. If you're an endodontist, if you're okay with doing, so they're the specialists that primarily will do things like root canals. So if you're okay with your day to day being, you know, root canals all day long, then
Yeah.
then then that's okay. You gotta be okay with that. I thought about certain disciplines, and I thought, I don't know if I would like to do this all day long. There being a general dentist does give you some variety, and within that you can choose. I have friends that really don't like certain parts of it and really love other parts of it. So they primarily will they'll kind of gear their practice so that they only do the things that they like, and then they have other associates, or they'll refer out the things that they don't like to do. So they still kind of, you can still kind of skew your day to do the things you enjoy the most, right? So if you really love doing, root canals, but you don't like doing extractions, you can still do that in your day. And just if you have patients that need extractions, you'll have other people in your clinic that can do it, or you'll have to refer it. But you can still kind of do that without, not necessarily having to specialize. So it's also a time, some people after dental school, they're for better or worse, they're burnt out from school and they don't want to do any more schooling. So they're just like, no, I'm good. I'm gonna just start my working world. So yeah,
Yeah.
things to consider. I mean, you might go into it thinking, I'm going to do this, I'm going to do that, and then after the 4 years of dental school, you might decide, no, I'd rather not. I'd rather just start working. So I guess it
Yeah.
comes down to the individual.
And time is definitely a big consideration, especially because after undergrad and dental school, that's 8 years that you just put into studying this. So I can definitely see why some people would be done.
Yes, yes, yeah, and it's not too. I mean, it's competitive. It's a time commitment. It's an expensive undertaking. Undergraduate. Then you go into dentistry. It's a costly endeavor, right? So you really have to make sure you want to continue maybe another 2 or 3 years on top of that. So for some people, it's not always financially an option. They have debt, and then they have to start working, which shouldn't be their only factor but it is a consideration, right? So
Yeah. But I found it really interesting that you said that dentists can kind of gear their work towards what they're interested in. That's also really, really good. Um,
yeah.
because then you have some sort of flexibility in
Hmm.
terms of what treatments you're doing. So,
That's true. Yeah. When you graduate, I mean, I was keen on doing everything. I'm like, everything that comes through the door, I'm going to do it. And now there's certain things I think, okay, you know what? Um, this procedure might take me much longer to do and I don't really enjoy doing it. I'll refer it if I have to, right? Like you don't have to take on everything that comes through the door. As long as you find your patients a suitable alternative, or you have someone else in the clinic maybe who does those things and enjoys them and does them more efficiently and with a smile on their face, then you then you
yeah.
send them there. So yeah, you can definitely. you can definitely pick and choose as you get more experienced and you build up your patient base, and yeah, you can definitely kind of gear your day towards your likes and your dislikes if need be.
Yeah.
So yeah.
And what's the job market like for new dental grads, both general dentists and specialists?
I think like we practice in a smaller, like more rural area of Ontario. Um, but I believe the major city centers are it's quite competitive. I think there's much more opportunity for people when they're starting out, especially to go to, you know, smaller towns and more rural areas, or even Northern Ontario or things like that, because there's just more opportunities and they're being underserved. And places like Toronto and the GTA are probably saturated. So um, it would be difficult to find, not impossible, you can still find work, but if you're a new graduate, you maybe only want to work Monday, Tuesday, Thursday, whatever,
Yeah.
no weekends, no evenings. Well, that might be difficult to find in like Toronto because they might only say, well, all we have available is, Thursday evenings and Fridays and Saturdays, and you didn't even, you whereas you go to a smaller market somewhere else, rural, and yeah, you can work your 9 to 5, Monday to Friday type of thing, right? So, and for specialists, I think specialists maybe don't necessarily have that. I think it's just building up their referrals and their client base. They might take a little bit longer in in an area that already has specialists, like like let's say just Toronto, for example, versus a rural area where they're underserved. They'll probably, on day one, you know, they'll have clients ready to go, right?
Yeah.
So
And for general dentists, you mentioned working in rural areas. Is it difficult to sort of pack up and relocate if you want to move later, um, because of your client base and the patients that you have there, or do you find it's easy to move around?
Well, I can only speak on my own experience, but what I ended up, I ended up working. The place that I co-own now is the first place I ever worked at. So
Oh, that's amazing. That's
I
awesome.
started there 20 years ago. I didn't live in the area, but it was about 40 minutes from where I lived. But I started working there. I kind of fell in love with the community and the patients and the staff, and you grow relationships, and then yeah, and then I stayed, and I I moved a little bit closer. So I don't know. I mean, I would find it difficult if I was there for an extended period of time, because you do form relationships and you get to know your patients and their families, and so for me it might be difficult, but I guess that's just me. I don't know if everyone would feel that way if you're only there for a short period of time. I guess you could, like anyone, if you had to pick up and move, you have to do what's best for you, right? So I'm sure you
It
could if
probably
you had to.
varies from person to person, I guess, in their situation, because that's gonna
Yeah.
vary.
Yeah, I mean, I think it would be difficult, like for someone to, if someone lived, again, we'll go back to the Toronto example, but if we said you live in Toronto, everyone that is your friends and family are all in Toronto, and now you're moving, you know, 8 hours north. I mean, that's a that's a life-changing move. So maybe that would be difficult. Um, but some people I know that have done that, they do come back, like they go out to start working and get experience, and then an opportunity might arise when they are able to come back closer to home for them. Or you never know, right? Life takes a funny turn. They meet someone there, get married. They set up their own family and roots over there, and they end up staying there. So um,
Yeah.
I have, yeah, friends of mine, call classmates. I had just an example, one that he went when he graduated, he went out to the East Coast as what he thought was going to be a temporary thing just to go and get some experience. And lo and behold, 20 years later, married, children, and lives in the East Coast and has no intention of moving back. So it just
Yeah.
it goes like that, right? So
Yeah. And your original plans might not necessarily be what you end up doing. So, um,
exactly, yeah.
yeah, yeah. In your opinion, are there certain specializations that have higher demand?
Um, I would say yes. If you're an oral surgeon, there's usually an added component of that because oral maxillofacial surgeons often will um, be the in cases of true emergencies, motor vehicle accidents, things of that nature. They are often in the hospitals as well, so they're called in when there is traumas like that, things to that nature. So they will often have that added responsibility um, versus other specialties where, for the most part, they are your typical workday 9 to 5, not necessarily after hours responsibilities. So I would say that one primarily. Off the top of my head, I don't think the other ones really have that added responsibility that they to be on call and to be available at any time of the day if the need arises. So and they're also dealing oftentimes with well, not usually life and death situations, but serious infections, things that need to be dealt with immediately, urgently. So, yeah, I think that would be the one I would say would probably be a bit more um, taxing and require a bit more of your time and versus specialties. Yeah.
On a different note, could you walk us through a typical day in your life?
Oh, okay. Yeah. So we're a typical day. Okay. Well, yeah. I usually uh, work. We start at 8 o'clock, so I, get up around 6:37, get ready, go. We work. There's usually half an hour lunch, and then typically the day ends at about 5 o'clock. And then, you need to go over charts or things like that come up during the day that you didn't have time to do. Um, if you're, well, if you're an owner versus an associate, I guess there's more responsibilities as an owner. You're still managing the clinic as well as seeing patients. So Um, there's extra administrative things you probably need to do. But generally speaking, I'm home by about 6 o'clock. And then the real work starts. Then, kids have to go to
Yeah.
practice and we got to eat dinner and things got to be done at home. So, um, yeah, that's a typical day. I'm usually not there, you know, beyond 6 o'clock. I'm usually able to come home by that time. So it's pretty consistent that way.
Yeah. Kind of on that note, how do you find the work-life balance? Do you, sort of work typical 8 to 5, 9 to 5 hours, or are weekends pretty common?
I guess going back to we were talking about, if you're a practice in a small town, your hours are generally speaking, 9 to 5 type of thing, or 8 to 4, whatever the case may be. We chose at our place, we have one Saturday a month that we work just to accommodate, it's because not everyone can come during the week. It's difficult. So we usually do one Saturday a month that we'll work like a day. And then every week we'll do one evening. So Thursday at our practice specifically is a Thursday. So Thursday evenings we work a little bit later, but that is by choice. I mean, you could just yeah, you could do Monday to Friday or Monday to Thursday or what, there's other practices they're not even open on Fridays. So it really becomes, as an owner, you choose those hours, but typically it's your regular 9 to 5 sort of schedule. And I think, yeah, the freedom you have a bit more freedom when you're in these rural areas to have those hours. I think if you're in a very highly saturated city center that has lots of dental offices and there's lots of, other offices that are offering evenings and weekends, then you're probably going to do the same. It really depends, I guess, but I would say in my experience, generally speaking, it's your 9 to 5, not, one evening and once in a while a Saturday, but generally no weekends. Um, it's usually pretty stable that way. Yeah.
Yeah. Overall, it sounds like the balance is quite nice, and that your schedule is quite regular,
Yeah.
which is awesome.
We don't often get called after hours. Most things, if they have a problem or they're having some dental issue, they usually just wait till the next morning and call us or show up at the clinic. So, yeah, it's pretty consistent. It's a pretty good balance. I would say. I think the only thing I would say while I'm there, my wife's often said, "Well, when you're there, you're not easy to get a hold of because you're not sitting at a computer, you're not near a phone. It's when you're there, you're fully immersed, so you're not as easy to get a hold of, and you're not, you can't multitask when you're when you're at work, which I know some people work at home or whatever. They're usually available and easy to reach. So for family members and things, sometimes it's a little more difficult to get a hold of you during the day while you're at the office. But other than that, yeah, your hours are pretty they're pretty good, I would say.
Yeah. I mean, one thing that I've kind of noticed from interviewing people, like especially those that work in medicine,
Yeah,
specifically, I've found that when they're at work, they're really focused on the work, but then when they're home, they can they can sort of separate their work life from their home life, and that you don't really bring that home with you, which I guess is good in that sense because then when you're there, you're focused on it, but then, when you're home, you can sort of
you can
um
compartmentalize.
put it on hold until the next day when you're back at work again, which,
Yeah, that's a good point actually, and I often we joke sometimes. We'll talk to our patients and they'll say, "Oh, they can certain jobs. Obviously, you can work remotely, so." They'll say, I'm going to go down to Florida for 3 weeks. I'll just bring my laptop and I can work from there. And I thought, oh, that's nice to have that ability to be able to work remotely. But then I thought, it's also nice on the flip side of that, where I can't bring my work home. So I don't have the choice. So it forces me to leave it at work. So, and that's a good thing, I think, sometimes, especially now in this day and age where you're always available, you're always on, your phone is in your pocket, everyone can get a hold of you. You can, emails are coming at a rapid pace and you're just always available, right? So in this sense, I can't bring my work home with me, which is maybe not a bad thing, especially when you have family and other priorities at home, right? So yeah, I think it's a good point you make actually.
I guess personally for me, when I've been considering careers, that's sort of one thing that was really important to me and appealing about um, specifically jobs that involve patient care, because then you can't do that from home or bring that home with you most of the time, I guess.
Yeah.
Kind of for work life balance, do you think that it's quite similar between general dentists and specialists, or um, would you say that it varies?
I mean, very generally speaking, it's probably very similar, with maybe the exception of an oral surgeon or someone who's in the uh, like works in the hospital as well, where you know, you could be called at any time. But generally speaking, I would say the balance is probably the same. You have your office hours. They're pretty predictable. Um, you're not often working after hours. I mean, sometimes things do run long, or there emergency happens, someone gets into an accident or something. But generally speaking, I would say they're probably pretty similar. Um, um, Same kind of hours, and yeah, balance is pretty close.
Yeah. I mean, that's definitely something that's been appealing for me personally. um, yeah, when looking into it.
Well, and the other like I was gonna also mention, like I worked as an associate before I became an owner, so I saw both sides of that. And obviously the associates, there's definitely more freedom and even greater potential for more free time, because you have less less responsibilities. Your only responsibility is to your patients, and uh, you could choose to work 3 days a week, let's say. Maybe you have a spouse that has a full-time job, and and you want to be at home a bit more, and you could do a 3 or 4 days at the most. Or, I have, like, we currently have associates that, yeah, they only work twice a week or three days a week, and that's fine for them, and it works well for them because they also have a spouse who works, and between the two of them, they're able to sort of manage their time at home. Um, so yeah, it even gets even more flexibility that way.
Yeah. On that same note, what do you think are the pros and cons of being an associate versus owning a practice since you've done both?
Yeah, well, so like we are saying, the associate, there's the I would say the obvious advantage is the freedom, less responsibilities. You you just you're only needed when you're there. You show up, you do your job, and you go home. And with the owner side of things, there's definitely more responsibility. And then you also get into, as an owner of a clinic, you're you're not only dealing with patients on the clinical side of things, but you're also dealing with staff and staffing. But the pros of being an owner, obviously, there is some flexibility in the sense that you can sort of set your own hours. You make the decisions. Um, what happens in the clinic. There's greater potential for income. You can work as much or as little as you like. So you have those advantages as well, which come with the greater responsibility. So it really depends, I guess, on the individual, what they're looking for. If you want no strings attached, no responsibilities outside of your hours, then probably associate would be the better track for you. But if you're looking to take on a bit more responsibility, and you kind of look forward to the challenge that of running an office. It's not all challenges, but just keeping everything running smoothly, then probably ownership is probably the better option then. So I initially went into it as an associate, not really thinking about whether I was going to own something or not. And then it just sort of, over time, you see how things are run, and you see how other owners are doing things, and then you think, okay, this is for me or this is not for me. Um and you make that decision. And sometimes opportunities come up too, and they just present themselves, and you're in that moment, and you make that decision. So um
Yeah. And like correct me if I'm wrong, but it sounds like the practice owners would also have quite a variety of responsibilities because you could also be treating patients, but then also be responsible for, like, managing the team or,
Yeah.
like, managing the business. So, um,
Yes.
it sounds like a different type of job than being an associate as well. I
Yes,
guess
exactly.
slightly, not completely, but, like, in certain
No,
aspects.
no, no, you're absolutely right because as an associate, you're essentially you're doing dentistry, clinical dentistry, day in and day out. That is your main responsibility. That's pretty much it. As an owner, you are wearing a couple of different hats. Of course, you are a clinician, first and foremost, but you also are a small business owner, and you, as such, you have the responsibilities that come with that. Now, depending again on the personality, some some dentists really relish that side of things, the business aspect of it, and they become. You'll often see owners that own multiple practices and basically almost become basically micromanagement of these, you know, three, four, five offices that they own, and 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 scale back their actual clinical dentistry quite a bit. So they take on more of a administrative role. But it really depends on the individual. So the owner can have a varied experience. It could be like in my experience and my partner who co-owns the practice, we are in the clinic 4 days a week practicing dentistry. We have staff that manages the office, does a lot of the administrative work. So we are primarily still clinicians at heart, and that's just our preference. But you could also go the other way and say, I want to own multiple practices and just run them and maybe only work in the clinic once a week, and so that your experience as an owner can be very different depending on your likes and dislikes and how you see yourself, you know, practicing. So yeah, but I think yeah, going back to the associate is primarily just you're doing um, clinical dentistry and that's it. So
But it's awesome that you have the flexibility to choose that and kind of pick what you prefer and what you choose to do.
yeah,
You're not kind of stuck in one role, which is great.
yeah, and I mean and you're not set to that. Like you may think you want to do that. I've had also friends of mine who had one practice and thought, oh, I want to own, multiple practices and just become a manager, and they didn't like it, and they ended up going back to their original, clinician in their one office, and that's it. So it really depends. Like some people, like I said, some people really relish that business side of things, and other people would rather just do dentistry and have someone else sort of manage that for them, that side of things. So yeah, you have that flexibility for sure. You can choose um, what what brings you joy, because at the end of the day, you have to be happy doing it day in and day out. Otherwise, you're just gonna, yeah, you won't last very long. You're gonna burn out or retire or find another career path. So
Yeah.
yeah.
So I've also read that some dental practices are being purchased by, like, private equity. So does that make it more difficult for dentists that want to own their own practice or um, like work on the business side of dentistry?
Well, yeah, no, it's true. There is an impact on. It started off. I believe it was more prevalent in the United States, and it's slowly crept into Canada as well. And there's a couple major um, corporations that have bought up a number of practices. Um, it doesn't necessarily, for someone wanting to start their own practice or take over an existing practice. Um, it's still very much possible, and I think there'll always be a place for that. What it has done is just made it a bit more um, difficult to, going back to the staffing issue. I think where we found um, the difficulties have been in holding staff, hiring new staff, because oftentimes these Corporations are either so numerous and they just want to entice people to come because they need employees, right? So they're trying to get them to come and work for them and offering them competitive wages even above market values, so it becomes difficult in that sense. I think that's where we have noticed it. Um, but I hope, I mean, if things are as they are now, I don't think that will be a problem. I think if someone still aspires to have their own practice, or like what I did, I started as an associate, and then when the owner eventually retired, you can buy their practice. I still think there is a possibility for that. I don't see that going away anytime soon. So um, yeah, I don't know if that will ever really, if we'll ever see at least in Canada anyways, a world where all the offices are owned by one giant conglomerate. I
Yeah.
still think it's mainly, they're still mostly are, you know, dentist owned, single offices, or the dentist might own a couple of offices, but it's not a corporation. So I think that will remain. I don't see that ever going away, to be honest. And that's a good thing. It's a small business, and you should have that. Should have those choices.
Yeah. Yeah, that's awesome.
Yeah.
For students that are kind of similar to myself, considering careers in medicine and dentistry and also other related professions,
Yeah.
are there any sort of unique aspects of dentistry that you think they should know before committing?
Ooh, pearls of wisdom. Well, I would say dentistry is unique in that you're definitely using your hands a lot. So you have to have some level of dexterity. You're
Yeah.
so if you're all thumbs, then maybe it's not the job for you, right? So, but not to say that everyone, you can learn and be taught and everything. But there's definitely, yeah, there's a hands-on aspect which is undeniable. You have to be able to use your hands, and it's a physically and mentally demanding job because you are seated a lot of the times. You're in a certain position, so there is that. Yeah, I mean, you're dealing with patients every day, face to face, right? So there's yeah, it can be it's a very rewarding job, but it is demanding. It does demand your time and your focus. You can't, like I said before, like when you're at work, you're those 8 hours or whatever, however long you're working, you're committed, you're fully immersed in that day. You're not taking calls and writing your grocery list for the day while you're there. Like you're fully committed. Um, so yeah, that is. But I mean, I think that's like that with a lot of jobs in the medical field. So I don't know that
Yeah.
dentistry is any unique in that sense, um, but it
Yeah.
is a good profession for sure.
Kind of getting close to closing up.
Yeah.
Um, how do you see technology changing your work as a dentist? Or even like in your time as a dentist, have you seen your work change because of technology?
Yeah, yes, I have actually. Well, I have joked in the past. I don't think AI is going to replace me just yet, but I think there'll always be a place for the dentist in the chair treating his patient or her patient, and that's a pretty safe bet, I would say. But where I have seen it, where technology has sort of played a big role, is on the laboratory side of things, where when someone is having a dental prosthetic made, um, a crown or a denture or something like that, that has changed immensely from the time in my 20 years. They don't do things the way they used to do from when I learned in school. It's all done now. It's all digital. It's all done by machines, which is great. I mean, the quality is the same, maybe even better actually, accuracy and all that. So that has changed. And I think probably we'll start to see soon. Diagnostically, there's things that are coming up. Um, reading x-rays and things like that, that you can use software that can help also screen for some certain kinds of pathology like diseases and things that um, we still do as clinicians, but you could have technology there as well to sort of as a backup, as someone, it's never helps or never hurts to have an extra tool in the toolkit, right? So I think that will be coming shortly, actually. So I think that's where technology will probably change dentistry a bit. I still feel like we're still you still have to sit in the dental chair if you need a cleaning, or or you need a filling or things like that. You're still
Yeah.
that won't change. You need a human touch for certain things, and that's for sure where that will come into play. But on other aspects of it, I think, yeah, we will see a lot of evolution. So
Yeah. It seems like changes would probably be things that help dentists instead of replacing them, like things that would streamline their work.
yeah.
But yeah, I think because you and other dentists work with their hands, that would be hard to replace or change.
Yeah, I don't see like robots or anything doing our work anytime, and not in the next
Yeah.
20, 30 years at least. So um yeah, and there's definitely like there's we joked about that, and I actually had a classmate of mine who he when he graduated, he actually tried to start a company that was using robotics to actually, if someone needed a crown on their tooth, he had a design for this robotic arm that would actually prepare the tooth. And we were thinking about that. Yeah. Now I don't know. I don't think he ever got it like off the ground, but the idea was there. But I was thinking, there's certain subtleties as I'm treating someone. I'm constantly surveying the whole situation. If someone like twitches or something, oh, are they feeling something? Is there something going on? Or, they're moving, like oftentimes we see kids, they're like moving targets. You have to adapt in the split second, right? So the things that a machine, I don't know, it would be so well at doing that kind of thing, right? So I think I don't
Yeah.
I don't lose sleep at night thinking I'm going to be replaced by a robot or anything like that. So
Yeah. And also communication with patients, you can't really
absolutely, yeah.
replicate the human aspect of that as well.
Absolutely. You need that. That part of the treatment is, the face-to-face communication, consent, explaining, answering questions, things like that. Half of the work you do is actually not in their mouth. It's doing all the explanation and taking questions and all that beforehand. So absolutely.
Yeah. Yeah. So, our final question, just to wrap the interview up,
Okay.
what is the most important piece of advice that you'd give to someone considering a career like yours, or in your field?
Hmm.
Just any general advice or
Most important.
words
Well,
that you have, words of wisdom.
um, I think it is a very rewarding profession. I know that nowadays it's probably, like anything, has gotten a bit more competitive. And I think if you really have to want to do that, especially to devote that kind of time and the cost involved. Like I was saying, it is an expensive undertaking when you're in school. But I think at the end of the day, if you enjoy working with people, and helping people, and really being able to see that, from start to finish, you can start with, like I was saying at the beginning, it's a very task oriented type of job. So you start off with a problem, and usually within an hour or two you've essentially solved that problem for that patient. And I find that very rewarding. I'm very task oriented, so I like to see things to completion. So I don't think I would do well in
Yeah.
a job that, where you're working on a huge project and you contribute a part of it, but you never really see that whole thing come to fruition because you just submit your portion and then you're done. Like I like to see things, in my hands. Here's the problem, we fix it, and now you're good, right? So um, I think if that suits your personality, then I think you'd really enjoy dentistry. And
Yeah.
the hours are usually pretty favorable. So yeah, you can still have a life outside of dentistry. It doesn't consume you, at all hours of the day. So yeah, that would be my, I guess, my pearls of wisdom to people. So
Yeah. Yeah, and as you said, you get to see like the impact of your work, and people appreciate what you do. So,
yeah, I think so.
yeah, yeah. Well, it's been great talking to you.
Oh, thank you.
This was really, really amazing. I've actually really been looking to speak to a dentist. And yeah, you gave me a lot of tips, a lot of insight. So thank you so much for doing
Oh,
this.
you're very welcome, Suhani. I appreciate you